Hello, I'm Dr. Stephen Smith, one of the GPs here at the Windrush medical practice, and I'm going to talk to you about the COVID and flu vaccines that you're due to be having today. If you have any questions following this presentation, please speak to the marshals who will direct you to the supervising doctor. The COVID jab that you'll be having is the Pfizer or Comirnaty bivalent vaccine. This protects from the original strain of COVID, but also the Omicron variant, making it one of the most effective vaccines at preventing serious illness from COVID-19. In terms of side effects, these you'll be familiar with previous jabs that you've had. Sometimes can cause a sore arm and can make you feel off colour for a few days. Occasionally can cause more severe or even anaphylactic reactions. But if that's not happened with your previous jabs, then it's highly improbable that it will with this. There are some extremely rare side effects that I'm duty bound to inform you of. Extremely rare is an inflammation of the heart, a condition called myocarditis or pericarditis, which causes breathlessness, chest pain or palpitations. This has only really been seen in young males in whom the condition resolved within a short space of time. Another rare side effect is Bell's palsy, which causes drooping of the side of the face. In people with a condition called idiopathic thrombocytopenic purpura, or ITP, it can cause a flare-up of this. And again, extremely rarely, it can cause a condition called capillary leak syndrome, where the affected arm and body can swell up with low blood pressure. As far as the flu jab's concerned, we'll be offering you the quadrivalent vaccine, which protects from the 4 strains of flu that we're anticipating circulating this winter. You'll be familiar with the potential side effects, again, sore arm and feeling off colour, generally mild. Very rarely, it can cause a condition called Guillain-Barré syndrome, which causes weakness of the muscles, which can affect the breathing. It's quite safe to have both vaccines together. In fact, we recommend that as being the quickest way to get your immunity up before the winter starts. To make sure that it's okay for you to have your jabs today, I need to go through a few screening questions, and if you have any questions following from this, please ask the marshals to pass you on to speak to the supervising doctor. So I need to make sure that you've not had a temperature today or in the last 24 hours. You need to make sure that you've not had your shingles jab in the last 7 days. We need to know whether you've had COVID or a positive test in the last 4 weeks, and we need to know if it's less than 12 weeks since you had your last COVID jab. We also need to know whether you've had any severe reactions to any of the vaccines before, and whether you've had any of those conditions that I mentioned, which are myocarditis or pericarditis following COVID vaccine, capillary leak syndrome, idiopathic thrombocytopenic purpura, ITP, or Guillain-Barré. And we also need to know whether you've had a severe egg allergy. If none of these apply and you're happy to have your vaccine, then please speak to the marshals who will direct you to our team of vaccinators. If you do have any questions following this, again, speak to the marshal who will pass you on to the supervising doctor for a further discussion. Thank you for listening.